Kristin Sohl is a dear friend of mine and a long-standing colleague, and I have loved working with her over the last number of years that we've had the opportunity and the privilege of working together. Kristin Sohl is Professor of Clinical Child Health at the University of Missouri. She is the Executive Director of ECHO Autism and the Scientific Advisor for the National Institutes of Neurological Diseases, Disorders and Stroke. She's the Medical Director for the MU's Missouri Telehealth Network and for the MU Office of Continuing Medical Education. By background and training, she's a pediatrician and with a lot of extensive experience and expertise in the medical diagnosis, evaluation, and treatment of children who have a concern of autism and other neurodevelopmental disorders. She's regarded as an expert in quality and process improvement, particularly for comprehensive autism diagnosis, diagnostic and longitudinal services. She is the founder of ECHO Autism, which is an innovative framework to increase community capacity to care for children with autism spectrum disorders. It's viewed as a national model in expanding autism diagnosis and treatment in underserved and rural populations. The ECHO Autism team has established partnerships with other children's hospitals and autism centers in more than 40 locations in the United States and 15 international locations. For the next 45 minutes or so, Dr. Kristin Sohl will talk about ECHO Autism communities. Thanks so much, Kristin.
Great, thank you so much. I'm really excited to be able to talk with everyone and learn a little bit more about ECHO Autism communities. So I'm going to share my screen so that we can jump into this talk. So I don't know about you guys, but I have learned so much this morning in our time together with these phenomenal speakers. And yes, the questions that are coming in through the chat box are amazing. I literally am having a hard time not just jumping in and answering questions and asking my own questions. So really fantastic questions and comments coming in. So again, let me share these slides with you all and we'll jump in. So it is a pleasure to come today and talk with you a little bit more about what ECHO Autism Communities is all about. So certainly, you know, you are here as part of a very large community of people who are committed to thinking about autism in a different way. Right. So what I'm going to do in the next 45 minutes or so is help you to understand a little bit about what our mission is and where it came from and where we're headed. So I hope that it's helpful to you. And I also am very, very open to answering questions and helping to kind of keep us all a part of this great body of learners. So in thinking about speaker disclosures, I made a comment about this at the very beginning, but I do want to make it clear that I am a faculty member at the University of Missouri. And so as such, I have a lot of different research efforts that go on, all really geared toward trying to move the field forward. I am very well aware that there are many different perspectives that come to our community. And so, for example, many of the great perspectives that came forth under Dr. Lofton's talk just recently about the different types of language that we use to talk about autism, the different kinds of things that we think about related to, you know, is it a disorder? Is it just the way that we think? Are there different ways that we think about this? Those are the things that I'm invested in. And so the different pieces that you see here are related to the different types of diagnostic instruments that we use. And so if you're curious about those, you're welcome to reach out to me and I'm happy to describe those further. But this is not that I'm invested in these companies, it's that I'm working hard with these companies to try to figure out how we move our field forward. So moving on into our topic at hand though, so really thinking about how and what is the landscape of autism in our space today. So when we think about autism, we know that there is an estimated prevalence of the autism spectrum disorder diagnosis that is measured by the Center for Disease Control on a regular interval. So our most recent estimate has it at 1 in 54 children with an autism spectrum disorder diagnosis. This most recent estimate came out in 2020, right about the time that the pandemic hit. And so certainly it wasn't a very big splash. So it was really released right at the beginning or middle of March 2020. But what we see here is that over the last couple of decades, we've really seen both an attention to the measurement of the prevalence of autism, but then also numbers that are concerning, that make us think about, well, what's going on? Why is there such an increase in this prevalence? And this isn't to talk about the why, but it is to reflect on the fact that this is a statement of of truth. There are certainly more people being diagnosed with autism than there were in previous decades. There's a lot to unpack there, but for the purposes today, what I want to point out is that some of the reasons why have to do with the fact that we have a profound increase in our awareness of autism. That's also allowed us to now be able to think about autism as something we can accept and embrace. And we'll talk a little bit more about that as we move forward with our comments. But nevertheless, the work of people like Autism Speaks, the work of many of you and many of us around autism awareness and what is autism has led to a better understanding of the autism spectrum. However, that's also led to a rise in referrals to better understanding that individual child or the individual child's potential developmental challenges that are going on. This leads to parents seeking answers and then more children needing help. Again, we can potentially have conversations about, well, do they need help, or is that just the way that they are? And should we let them continue to develop on their own paths? Those are things that I think the field is continuing to look at and to discuss. But I can assure you that as a parent myself, you know, when I look at my daughter, I look at my son, I'm, as a parent, always trying to think about how do I help them meet their goals as individual humans? And I think all of us as parents have that in our mindset as we're thinking about moving a young person forward. And so those are the things that we think about in this context too. But it's also about advancing the needs of that child or that person as they grow up and letting go so that they can fly on their own into adulthood and be a successful individual. So we'll talk some about that too. But as these gaps have continued to grow and as more and more awareness has arisen about autism spectrum disorder and more people are seeking answers, we have been then faced with a bottleneck where there are not a ton of treatment options, whether that be services for intervention, whether that be services for crisis behavior, whether that's services for diagnosis, or just simply to better understand a person on the spectrum. We also know that there are not a ton of trained professionals. There's a lot of work that we're doing here through ECHO Autism and others. And then that leads to a lot of wait lists. I would imagine many of you who are listening have experienced a wait list somewhere, whether you're a provider who has a wait list to get in to see you, or whether you are a parent, an autistic person, or someone else in the community, you've heard about the wait lists. They're everywhere. And so certainly that is not a lot of fun, no matter what perspective you take. And so one of the things that I have the pleasure of being able to have experienced is perspective. So I am a pediatrician, but I've always practiced specialty care. So I continue to practice specialty-based care for autism. I specialize in the evaluation, diagnosis, and then longitudinal care of individuals on the autism spectrum and their families. And so what does that mean? That means for my career, I have been mastering at the evaluation of children as well as adults on the autism spectrum, all the way from about 12 months of age forward. And then really walking the journey with families as they go along and raise their children. And then as that child grows into a young adult and into adulthood, it has been a marvelous experience. And I have loved every minute of it, because not only do I get a chance to be walking hand in hand or side by side with a family and then that individual as they mature through their life, but I've also had colleagues, as you've gotten a chance to experience some this morning, but colleagues around the world who are evolving in their own knowledge and their own skills. And so what a pleasure that has been. However, what I also know as a specialist who provides care to many rural communities and underserved communities, it takes great efforts for many families to be able to access that type of care. So what happens to a family who lives just a little too far from a specialty center or a large city or an academic center, or who lives in a different country or in a different county or somewhere where they can't access that type of care? What does that look like? My average patient travels about 100 miles to see me one way. That's a lot of distance. And so that's great for the families who can do that. But what about the families who can't? What does that mean for their child? Or what does that mean for that young person, that young adult with autism who wants to have access to best practices? What does that look like? So then let's look over to a different perspective. As a pediatrician, I am trained as a general pediatrician. So I'm keenly aware of what it means to be a general pediatrician, a primary care doctor. I practiced as a general pediatrician very minimally, but I did practice as a general pediatrician for the first 5 years of my clinical practice. And so I know that we only receive 4 weeks of training in our entire pediatric residency program. So for those of you who are less familiar with the medical training system, we take 3 years to go, we go through our undergraduate degree, our medical school for 4 years, and then we have 3 more years to really, really intensely learn pediatrics. But within that 4 years, or 3 years, I'm sorry, we are learning intensive care, we're learning cancer care, we're learning inpatient care, infectious diseases, all of those different things that take up our, and make us pediatricians. But only 4 weeks out of that time is spent in learning development. So Down syndrome, ADHD, autism, all of those things, 4 weeks. And then when you go into practice as a pediatrician, and this applies to all of our primary care practices, family physicians, et cetera, you have minimal information kind of going into your practice. And so you have to keep learning, right? You're going to hear that theme. And yet, guess what? Families come to love and trust you as their primary person. You are there for them from the moment your child is born. You are the one who helps to partner around what to feed the baby and how to change how often to change diapers and all these different things about growth and development. And yet, as pediatricians and family physicians and nurse practitioners and physician's assistants, sometimes you don't have all of the knowledge. And so what does that mean for families? So that family perspective then is often not fully informed about that system. And so when a pediatrician or a family physician or a nurse practitioner in that primary care space says, well, let's just wait and see. I hear your concern, mom or dad. I know you're saying that you've looked at the red flags for autism, but I think they're fine. How does that look, or how does that feel, and vice versa? So what if we were able to harness those perspectives, the perspectives of all of us thinking about improving outcomes, not just the specialist thinking about, well, why isn't the pediatrician screening more? Why isn't the pediatrician referring better? Why can't we do more through our primary care community practices? What if we were able to start to think about things in a different way? And so I'm going to walk you through a little bit of how we evolved as a program and how we're really changing the way we think about autism-based community care, and really thinking about how do we work together to imagine a different way. So for a minute, think about our healthcare system. We've all been living in a global pandemic, an unprecedented, there comes that word, right? I think we all need to have some kind of penny jar every time someone says unprecedented, because it's such an overused word, but we're living in unprecedented times, a global pandemic. And so we have healthcare system problems. There's so much demand for the need for healthcare, and yet the supply is not plentiful. When you are living in an underserved location, whether that be, again, a rural community, an underserved community, an urban community that maybe has difficulties accessing the healthcare issues that you may need. And so what we know, and this is bore out in research over and over and over again, that we know that the rising inequities related to healthcare, the equity issues related to our healthcare access leads to measurable declines in healthcare. So how do we then start to mitigate some of this? What do we do about this? Do we just sit back and watch and say, oh, well, you live in a small town, I don't know what to tell you. Because you live in a small town, your child's just not going to thrive like they would if they lived somewhere else. Is that something that we're okay with? Is that something that we're okay to think about? Or, for example, if you live in a different country, or you live in an urban center where maybe it's transportation that limits your access, or maybe it's a parent's job, they're working 2 or 3 jobs to try to just put food on the table. Is that something that we're okay with? And thinking about these issues, the supply and demand, and how do we think through these things? Well, luckily, we've been doing this in a new and a different way. And so I'm going to share with you this notion that we call ECHO, and really am so passionate about the work that we do and the work that we are part of, and then walk you through how it applies to the work that we're doing. So at its simplest essence, ECHO is about moving knowledge, not people. I don't know if you've ever thought about it, but really when you get sick, if you're really, really sick, you have to keep going up the ladder, if you will, to higher and higher levels of care so that you can get access to your very extra specialists. And by sick, by the way, I'm using that medical terminology, but it could be, if you have a really significant challenge in anything, you need to go see an extra specialist in something. And yet, what if we had a different way of thinking about it? What if instead we said to the I like to call them Uber specialists. What if we said to our Uber specialists, well, yeah, that's great that you have this expertise, but what if in turn you could share that back out? You can still have it, but knowledge is not something that has to be hoarded. Knowledge is actually something that when you share it, it comes back to you. It's not something that is, when divided, it is less. It's one of the few things that when you give it, you don't lose it yourself, right? Unlike money or unlike other types of resources, knowledge can be shared and you don't lose it yourself. And in fact, it multiplies. So this idea was actually innovated into something that we call Project ECHO. And it's an acronym. Some people don't realize that, but it stands for Extension for Community Healthcare Outcomes. It was founded originally by my dear friend, mentor, and colleague named Dr. Sanjeev Arora. He's a liver doctor or a hepatologist, and he's from New Mexico. New Mexico is a very rural state. And he, like many of us, like myself in particular, was taking care of patients and still does take care of patients, by the way, with hepatitis C and other liver diseases. He was one of a very few people in the state of New Mexico taking care of patients from all across his state. People were driving hours and hours and hours to get in to see him. And often it was too late. It was too late for them to have treatment for their end stage or their liver disease. And unfortunately, in that situation, many of them were terminal by the time they made it to the specialty care that they needed. So Dr. Arora set out to start thinking about different ways to manage this and how to help the population in New Mexico. He would do webinars, he would do brown bag lunches out into the community in rural New Mexico and all around, trying to think about how do we redesign this? He knew he had knowledge that he could share, and he knew he could teach people how to do this and mentor them to do this in a different way. But those kind of old school fashioned old fashioned ways of doing teaching didn't really work, because I think what we know, and if you really think about how we learn as adults, we learn by doing. We learn by doing things that are time relative to us. Adult learning theory is so relevant to how we learn. And so I'm so thankful to him for creating the ECHO model. And I'm going to show you how we have then adapted that to autism and disabilities all around the world, and what we are so proud of the work that we are doing, both as part of the broader ECHO mission, and then also within our own ECHO Autism communities. So the ECHO model is quite straightforward. We follow kind of an ABCD principle, but it's using technology to amplify scarce resources. In this case, it's scarce resources around knowledge. So ECHO at large, so the Project ECHO model, is being applied around the world. Our goal through the ECHO model is to touch 1 billion lives by 2025, and we are on our way. We have the ECHO model being applied to hepatitis C, the COVID pandemic, chronic pain through the Department of Defense, PTSD, mental health, huge societal issues, all who have experts all around the world, but moving that knowledge to the people is the innovation here. So rather than saying like, well, sorry, if you can't make it to the right place to get to the expertise, then you're out of luck, right? You're out of luck. What kind of thing are we saying when we say things like that to people? So is there a different way? And the ECHO model has been embraced worldwide by governments, by our different federal agencies. Our own federal government has a couple of different ECHO acts that have been unanimously supported by our federal government and passed. When do we get to say things like that, right? And so certainly what we're doing here is we are amplifying scarce resources through technology. So we use platforms like Zoom, which back when we first started this, people didn't know a whole lot about Zoom, but thanks to the pandemic, now we know more. But we don't just stop there. It's not just leveraging, using technology to just you leverage scarce resources. It's about sharing best practices. So today you've been hearing from experts about best practices. You've heard about best practices around, thinking about behavior, about thinking about sexuality, thinking about play skills. And so when we share best practices, we reduce disparities. We allow people to have equitable care when and where they need it. But we don't stop there either. We do this through case-based learning so that we can make it relevant and time linked for the people who need it right where they are. This is how we learn and master complexity. If you want to teach somebody how to drive, I would dare you to try to give your teenager the driver's manual and then the keys to the car, right? We don't do that. That's not how we do it. We don't send somebody to a webinar about driving and then just say, okay, here's the keys, right? We sit with somebody, we guide their practice, we help them learn. And so certainly this case-based learning to master complexity is all about what we do. And then we monitor outcomes. So what does that mean? That doesn't mean we're like sitting like Big Brother, observing what people are doing. We are thinking about how are we making sure that people are getting what they need? How are we learning from our community? And we're going to show you a little bit about how we do that right here through ECHO Autism. It's also all teach, all learn. And how does that apply? So that applies because if I'm not hearing from our participants, our learners who are living in rural and underserved communities, or who are living with autism or autism and mental health or autism and transgender, whatever, if I'm not open to learning from them, then I'm not learning, right? And then I'm not effective. And so how do we do that? And how do we do this well? And so ECHO is all about this learning collaborative in an all teach, all learn fashion. I've already said this, but it's definitely not a webinar. It's definitely not a stagnant process. It's all about collaboration and it's all about learning. And so that's really what ECHO is designed to do and designed to be part of. So that way we can move that knowledge, but also generate new knowledge, so that we are working together to advance best practices in all communities. So when I say things like ECHO Autism Plus, this is what I'm talking about. So we are imagining an entirely different way of doing things. I have, as you've heard, Dr. Weatherby and others have talked about our partnerships around research and different things like that. And that's wonderful. And of course, I'm committed to continue to develop evidence-based practices, new science, new things. And yet that's awesome as long as we can get it out into our communities, into our clinical practices. So scientific discovery is absolutely essential and we do need it, but that needs to be informed by people with lived experience. It needs to be informed hand in hand, co-produced, if you will, to get it to be something that's meaningful. That scientific discovery, you may or may not know though, has been studied, and it takes an average of 17 years to get a scientific discovery from research to the bedside, the bench to the bedside. So it takes 17 years on average to go from a new research discovery out into our clinical practices, all the way out to where we all can use it. That's a really long time. And so you can imagine that means that's going to continue to perpetuate those inequities that we see within our communities, and then the disparities that we can measure. But then what if we didn't stop there? What if we didn't stop with just clinical practice and we kept pushing the envelope to say, actually, we then need to motivate, activate, and collectively work together to change policy and advocate together for what our communities need, what we need to actually continue this innovation and continue to imagine a system where we can all be able to advocate for people with all abilities to lead their best lives. And so that's really what we're doing here with ECHO Autism communities. We're imagining communities where people with autism and all abilities can live their best lives. So we do this through democratizing expertise. So again, that's sharing freely and disseminating best practices to mentor and guide communities of clinicians, educators, and advocates. That means family advocates, self-advocates, any old advocate, whatever advocate hat you want to wear, creating local expertise and increasing access for autistic people and their families. So we do a lot of this through mentorship, guided practice to build capacity and grow local expertise. I know there were a lot of comments and questions about how do you be culturally relevant? You be culturally relevant by engaging people who know their culture, who understand their culture, right? You can look at me and think I'm a white woman who can't possibly understand certain things. But what you don't see behind the obvious headline is that I am a quarter American Indian. I am a you can call me whatever you want to call me, but I'm a teen mom who has busted her hiney to do all the things that I've been able to do. Those are the subtext to my headlines. And yes, you can think you know who I am by looking at my skin color or my hair or whatever I might be thinking or doing, but those are the headlines. We have to dig deeper to get past those headlines so that we can grow and learn together. So culturally, that's how we are able to adapt and grow local expertise, because ECHO isn't about hoarding those pieces of knowledge. It's not about me sitting up here and saying, I am the keeper of all autism knowledge, right? It's not. I don't know everything. I'm the first person to tell you I don't know everything, and I am thankful that I don't know everything. In fact, most of the time I am learning something new, probably about every 5 to 10 minutes. For those who know me, they know that's true. And so I love that. And so we embrace some very important core values here at ECHO Autism Communities. First and foremost is person and family-centered care. What does that look like? We could break this down. So I've broken it down into its core concepts, but this could go broken down into even further core concepts, but it's about dignity and respect. We respect each other and we honor each other's dignity. We also believe in co-production of care and discovery. That's that research discovery that we're talking about. Do we always nail it perfectly? No, right? But when we hold these values at our core as partners, then that is when we start to continue to grow and learn. We also believe wholeheartedly in shared decision-making, that participation within each other's comfort level. I think about this when I am seeing patients, and sometimes they'll be like, well, I don't know, you're the doctor, you decide. Okay, right? I can totally decide. Of course I have an opinion. And yet it's also my job to partner hand in hand, not just with the parent, but with my patient as well. So if I have a child, and I'm almost always doing this, even if it's a little itty bitty kiddo, making sure that that child knows what we're doing, how we're doing it, and where we're headed. So if they're able to make decisions, and by the way, that does not mean that I'm guessing if they're able, I am doing everything I can to engage them in that. And then providing decision support so that people can make informed decisions for themselves, information sharing, and sharing what I do and I don't know. Those are important things. And that's all of what we do through ECHO Autism, is we teach those core principles and really make that come to life. We also believe in whole care for the whole family. And so this is an essence that has really been borne out through our work within Autism Speaks, within the Autism Treatment Network. So I know that many people have a perception of Autism Speaks that may or may not be accurate based on your connectedness with Autism Speaks. But I can tell you that as a member of the Autism Treatment Network, which is something that we have done for numerous years, and as Autism Speaks has grown and learned to listen and be actively engaged with their communities, this is something that's really been instilled in me through that interaction, that we are not taking care of a person in a silo. We are taking care of a family that is interdependent on each other. We are taking care of a family who operates within a system. And the more that we can work together, the more that we can better understand an entire system. What does it mean for a parent to have to take off work? I've had families lose their jobs just simply because they had to take off work to come to an appointment. How can I help mitigate that? What does that look like? What does it mean to actually have to do some of the things that we ask families to do? How does that affect a mom's mental health, a dad's mental health, a dad's perspective of his ability to provide? What does it mean when we ask families to do different things? And so this notion of interweaving our important core values is absolutely essential to the work that we do and the growth of our ability to imagine a new way of doing this together. It all really anchors ourselves in this concept around all teach, all learn. I said this before, but we can't do this alone. We can't do this in silos. The only way to advance to a system or to a space where we're imagining a new way is to do this together, where we all learn together, and then we are able to continuously bring new knowledge and new skills to the forefront. I like to think about this as embracing curiosity. So I've often thought about what is it about ECHO that I love the most? And I think it's about being curious. We are constantly asking questions. Help me understand this. Can you clarify that? I loved how you brought forth this idea. I never would have thought about that. Help me think about how you learned this or that or this or that. And because it's so interdisciplinary, or transdisciplinary is the new way we think about the work that we do, not to be confused with transgender, by the way, because some people get those things all sorted up in their minds. This is about thinking about how I, as a pediatrician, though, can think about things from the perspective of an occupational therapist, or how I, as a pediatrician, might want to think about things from the perspective of another parent, or from the perspective of a funding agency for a particular service. That's what that translation of understanding can look like. But it's about embracing curiosity. And if I stay stuck in just my narrow viewpoint, no one's going to grow. And so how do we look at things through a lens of curiosity and really keep learning? It's such a powerful way for us to think about things. And then last, but certainly not least, we see the possibilities in all abilities. I have learned from Alicia Curran, who you're going to get to meet in a very short order, that not only do we have the opportunity to see abilities when they're there, but we see the possibilities in all abilities. Just because somebody is deemed low functioning or high functioning, which I frankly despise those terms, we are able to look beyond whatever label has been applied to someone and see the possibilities in all abilities. Right here, I want to say that, a lot of people have labeled me, and probably you, with all sorts of things. And yet that does not mean those are the things I'm capable of doing or that you're capable of doing. We have possibilities in all of our abilities. And so allowing ourselves to know that, and then think about that with a family or an autistic person, and think about how to keep moving that person forward towards their best life. That's how we arrive at imagining communities where people with all abilities can live their best lives. So our origin story, just to give you a little bit of background about where this all came from, really started with me being in clinic, and also me being the medical director of a major autism center, and trying for a long time to think about how we could get more kids served, working on the wait list, working on different strategies, trying to figure out how to get more kids in, both for diagnosis and follow-up care and treatment. And boy, I tell you, I have a lot of expertise in quality improvement and systems design, and you name it, I like to go figure out new stuff. And, we would make headway and continue to make headway. And yet at the same time, more and more and more people needing answers. So when I would see families in my clinic room, and I, like I said, I do continue to see patients, when I see their struggle, when I hear them say, well, I've been asking somebody to help me for a year, but they just said, well, we had to wait. That was painful to know that there were people with answers all around the world, my friends in many ways, right? That we had knowledge that other people didn't have. What could we do, and how could we do it, and how could we do it in a different way? So fortunately, and thanks to the Missouri Telehealth Network and Dr. Sanjeev Arora, I was introduced to the ECHO model in late 2014. And very quickly after, yes, this is a true story, when I was sitting there listening to him talk about hepatitis C and the ECHO model, I was sketching out the first ECHO Autism on a piece of scratch paper at the University of New Mexico. And there we went. So thanks to my team at the time, who was made up of Dr. Micah Mazurek, who continues to be an amazing collaborator and leading her own ECHO Autism programs at the University of Virginia, and Alicia Curran and several others, away we went to say, we're going to do this different. Let's test it out and see what we can do. So we started out with primary care, and that's been our kind of flagship model for many years, and has continued to grow. We now have, around 40 ECHO Autism primary care programs around the United States and Canada, working very hard to work hand in hand and accelerate the skills and the knowledge and the practice of our primary care colleagues. And we're doing this through, again, that notion of embracing expertise, but not owning expertise. And how do we then integrate the lived experience voices? Because primary care, pediatric primary care, is focused on early identification, as well as screening and management of common underlying medical and psychiatric conditions like sleep, GI, diet, as well as ADHD and anxiety. This is how our team shapes up. You've gotten to hear from some of them this morning. And yet we also we're the very first ECHO program in all of the ECHO movement, so not just autism, but all ECHOs, to integrate a lived experience voice. So when we say that, we mean that. We live out our model of shared decision-making. And why I'm so honored that Alicia Curran, who again, you'll hear from later, is the first parent or person with a lived experience to be an equal voice on our expert team. So each of us are subject matter experts, including Alicia. We've gone on to set the bar high for all of our ECHO Autism teams to include a lived experience voice on the expert panel, so that we can really disseminate and show model how you integrate that lived experience. We also have self-advocates on many of our teams, and so thankful to that lived experience voice. For those of you who are interested in our research, we have quite a bit of it, but just a couple of quick highlights that came from our origin story. And I'm not going to go into a lot of it, but I just wanted to highlight it for you. So here we have our pilot study that showed ECHO Autism was feasible, again, in the pediatric primary care space, and reported high satisfaction with our program and demonstrated improvements in self-efficacy. For those of you unfamiliar with self-efficacy, that's someone's confidence in their ability to perform a task. You can have all the knowledge in the world. I could take a test and ace it on all sorts of things, but that doesn't mean I'm going to go out and do it if I don't feel confident in my ability to do something. So showing that we saw statistically significant improvements in autism screening and management, as well as the use of autism-specific resources, was a very big deal. This graph shows our statistically significant improvements in our overall self-efficacy. Again, this work was led and continues in many ways to be led by Dr. Micah Mazurek at the University of Virginia, and an amazing colleague. And then we broke it down into our into our subcategories where we looked at screening, resources, common medical conditions, psychiatric conditions, and then a smaller group of other issues. But what does this mean? This means that more pediatric healthcare professionals were able to screen effectively. We're able to support patients and parents in accessing resources that they needed. And then also looking at, okay, your child is having a lot of sleep issues. I can help you. Your child is having a lot of GI or constipation or feeding issues. I can help you, right? It's giving tools where tools are needed and starting to help answer some questions while they wait. So certainly that was great. We also know that AAP, the American Academy of Pediatrics, has been recommending standardized screening guidelines for a number of years, 2016 to be specific. And yet we also know that study after study after study has shown that those are not always adhered to. And so in our very first pilot from back in 2015, we looked at this and we're able to show after 6 months of participating in ECHO Autism, we saw a nice self-reported improvement in adhering to the AAP screening guidelines. This matters because the earlier we can identify symptoms of autism, the earlier we can help a child and their family continue to advance those developmental skills. Of course, if we want to think about and talk about neurodiversity and neuro acceptance and all of the different things that I know are a very important topic to many right now, that's great. And yet I can tell you right now that if you're 12 to 18 months to 24 months old and you're the parent of one of those young toddlers and your child's not talking, I can tell you right now that that is something that's incredibly important, is to understand that development is key. And so making sure that we're screening for developmental milestones and autism-specific red flags is really important so that they can have their voice to be able to talk to us about neurodiversity when they get to the age that they're able to do so, because that's an important skill for them to be able to talk and communicate with others about their voice and their interests. So then we knew we needed to take this to a bigger trial. So we were very blessed and honored to have the opportunity to do this through the Autism Speaks Autism Treatment Network in partnership with the Autism Intervention Research for Physical Health Network, which is part of HRSA. And this is our 10-site clinical trial. So we did this with our partners all across the country and showed very similar results in this same vein. And so we had results showing increases in autism screening, general developmental screening, autism knowledge, so knowledge of autism, as well as, again, those overall self-efficacies. We also measure decreases in the number of perceived barriers. So this is my favorite because it is so important to me that people can access best practices no matter where they live, no matter what access they have to transportation or what have you. And so we were able to show that we saw statistically significant improvement in those perceived barriers, such as, I don't know how to bill for this. I don't know what questions to ask. I don't know how to screen. All of those kinds of things that are common in our primary care providers feeling like they're not sure what to do. We saw those nicely improve over actually our first 3 months of ECHO Autism in our clinical trial, and then continue to improve over time after that. So that was a little bit about our origin story, and we continue to really work hard in that primary care, pediatric primary care space, but we haven't stopped there. We now have ECHO Autism programs that span many, many topics. This is actually not an all-inclusive list, but you can imagine that same model that I've shared with you, where we are really advancing the use of technology to leverage that technology and amplify scarce resources through best practices and case-based learning. We have topics, ECHO Autism topics in all of these areas and more going on around the world. And so we are so excited to be able to be doing this with people all around the world. Here just in Missouri, we are so thankful to the Missouri Department of Mental Health, as well as the leadership of our governor and others who see the promise of being able to imagine a new way of autism care and autism delivery here in Missouri. So this is just the numbers from our Missouri programs. And keep in mind, we have programs, another 40 programs doing similar things across the country, and then another 15 or so around the world that are doing ECHO Autism programs as well. So you can see the reach is quite phenomenal, and we're so thankful to all of our learners. Our community is huge. Our community is diverse. We have ECHO Autism programs in Africa, in Vietnam, Africa and Southeast Asia, and in Latin America, in Europe, and all over. And so we are so grateful. These are just some small snippets of the faces that make up ECHO Autism communities. And these are mostly our hub teams, our content experts, and not as many of our participants. But you can imagine all of the thousands and thousands of people who are learning with us as part of ECHO Autism. I want to invite you to know that there are so many resources available to you as we continue to build our best practice resources. We do have a website. We are also heavily trying to reach as many people as we can, because not everybody has great, reliable access to different types of internet. So that's why we're in different social media platforms. That's why we're trying to be available to as many people as we can be, because no matter where you are, we want you to have access to best practices. That's the goal here, best practices, regardless of where you are. So bringing those best practice components to local communities. And so here you can see some pieces of our website just as a resource to you. And you can see if you're a family, you have places to go. If you're a healthcare professional or other type of professional, you have places to go. We also are doing lots and lots of work about bringing you snippets of information or more in-depth pieces of information. We have expert videos that are shorter content if you have less time, or you only want to listen to a handful of minutes about important topics. But then we also have webinars that are on-demand resources for you. So if you want to dig deeper into something, all of us who have content expertise or subject matter expertise are really working so hard to make sure that you can have access to the things that you need and want. And by the way, we are not an exclusive club. If you feel like you have content expertise that you would like to share, let us know. We love to learn together. We also have lots and lots of resources that have been developed with others all around the world and want to continue to grow these best practice resources for everyone. So certainly we have it categorized by category, but we also have it by buckets or topics, if you will. And so we want to make this easy. If you are a clinician that wants to support families, we were trying to make this easy for you so that you can just quickly share or send someone to a resource topic and they can go from there. Most importantly, though, we want to encourage you to join us, to learn with us. If you are in certain places around the world and you feel like a time zone is a barrier, don't let it be. We are growing teams everywhere. Why? Because we need to move this knowledge and move this knowledge fast. There are millions and millions and millions of people with different abilities around the world who are marginalized and stigmatized because of their disabilities, because of their different abilities. And yet we know that we can see their possibilities within their abilities. And so when we are able to move and mobilize our communities to understand and imagine what we can do through and together, that's how we change the way we do things. And so we want to invite you to come and learn with us. You can join by different topic. You can join by different location. It is free. It's no cost. That's how ECHO works, all of ECHO's. And so we are so delighted to be able to offer this to you. We do want you to continue to engage with us. We, again, are in different social media platforms. Why does this matter? Is this about self-promotion for ECHO? No, it isn't. This helps us all teach and all learn. This is how we continue to learn. If you have something to say, say it. We're not afraid to learn together. we are not afraid of you saying something like, you screwed up, like you missed the mark there, you missed the mark. We don't like being told that you're treating us. We don't think we need to be treated. Say it. But then also equally respect the opinions that you're going to hear back. That's all it takes to share and to tell your story, right? That's how we all learn. And as we learn and as we start to grow and learn from each other, that's how we build together and we imagine together where people with all abilities can lead their best lives. And so I would definitely invite you to engage with us however you want to. If you're not the social media type, totally fine. That's okay. There's a place for you. We want you to come and to learn and to grow. And if you're also interested and you want to make your own ECHO Autism, let us know that too. We train people all around the world to use ECHO Autism and the ECHO model. So if you're interested in doing it for something besides just autism, let us know. By the way, if you come and learn with us, what you'll learn is everything autism plus the kitchen sink. We like to think about it. So you're going to learn about trauma-informed care. You're going to learn about sexuality. You're going to learn about all sorts of things. But we learn about it through the lens of the core values that I mentioned. And so certainly we invite you to come and learn and join us on this journey. And we're so thankful that you've joined us today and hope that you're learning and are learning new things each minute of the day, because I know that I am, and I am very thankful to you for joining us.